Hi, my name's Molly, and today I'm going to be going over my case study presentation. So, my topic was multiple sclerosis. And what is MS? So, basically, MS is when the body's own immune system attacks the central nervous system and causes damage, which slows or stops nerve transmission. So, the immune system attacks the protective sheath, which is the myelin sheath, that covers the nerve fibers and causes communication problems between the brain and the rest of the body. MS can affect vision, sensation, coordination, movement, and bladder and bowel control. The disease can cause permanent damage of the nerves, and the signs and symptoms vary widely depending on the stage and type of MS that you have. So it really depends on the amount of nerve damage and which nerves are affected. Some people with severe MS may lose the ability to walk, while others may experience long periods of remission without any new symptoms. So there are about 4 types of MS, and there's no way to predict how individuals, their disease will progress. However, there are 4 disease courses, which are also called phenotypes. So the first one is clinically isolated syndrome, which is SIS or CIS. And this is the first episode of neurological symptoms caused by inflammation and demyelination in the central nervous system. And people who experienced a CIS may or may not go on to develop MS, so it's actually not a characteristic in diagnosing MS because you may or may not develop it later on. It may just be an initial symptom. So the next one is relapsing remitting MS, and this is the most common disease course, and it's characterized by defined attacks of new or increasing neurological symptoms. And these attacks, which are also called relapses, are followed by periods of partial or complete recovery. The third one is secondary progressive MS, and this usually comes after RRMS. So people who are diagnosed with RRMS will then transition to a secondary progressive course in which there is a progressive worsening of the neurological function. So then the last one is primary progressive MS, and this is characterized by worsening neurological function from the onset of symptoms without early relapses or remission. Okay. So the disease course of MS, there's normally small increases in body temperature that can temporarily worsen signs and the symptoms of MS. At least 50% of those with RRMS eventually develop a steady progression of symptoms within 10 to 20 years from disease onset, which is, like I said before, would then turn into the secondary progressive MS. And the worsening of symptoms usually includes problems with mobility and gait. And the rate of disease progression varies greatly among people with secondary progressive MS. Some people with MS also experience a gradual onset and steady progression of signs and symptoms without any relapses, known as primary progressive MS, which I also said in the slide before. So these are some risk factors and complications. For complications, individuals with MS can usually run into muscle stiffness or spasms, paralysis, and typically in the legs, either one or the other. It's usually just on one side of the body. They can also experience problems with bladder and bowel or sexual function. They can also go through mental changes, whether that's forgetfulness or mood swings, and they can also experience depression or epilepsy. And some of the risk factors are age. So actually, MS can occur at any age, but the onset usually occurs between 20 and 40 years of age. And for sex, women are more than 2 to 3 times more likely of having relapsing remitting MS than men. You can also get certain infections, which so certain viruses have been linked to MS as well. Climate, there's more MS is more common in countries with temperate climates such as Canada, northern United States, and New Zealand. Vitamin D, having low levels of vitamin D and low exposure to sunlight and smoking can also be a risk factor for MS. So the cause of MS is unknown. There isn't anything specific to cause this disease. Basically, like I said before, the immune system destroys the fatty substance that coats and protects the nerve fibers in the brain and spinal cord, which is the myelin sheath. When the protective myelin is damaged and the nerve fiber is exposed, the messages that travel along that nerve fiber may be slowed or blocked. And it isn't clear why MS develops in some people and not others. There may also be a genetic factor there, but it's not common, or it's not a risk factor. However, they do say if you have a family member with MS, you can potentially give it on to your offspring as well. So this is just immunologic factors of MS. So there's a couple of cells that actually are affected in the disease progression. So T cells become activated in the lymph system. They enter the CNS through blood vessels, and once in the CNS, these T cells release chemicals that cause inflammation and damage. And this will result damage in the myelin, the nerve fibers, and the cells that make myelin. There's also T regulatory cells, which they are actually supposed to turn off the inflammation that the T cells create, and in MS, they do not function correctly and do not effectively turn off this inflammation. There's also killer T cells, which directly attack and destroy cells obtaining certain characteristics. And the last cells are the B cells, which produce antibodies and stimulate other proteins. And in MS specifically, these cause damage to the central nervous system. So, symptoms of MS, an individual can experience numbness, weakness in one or more limbs that typically occurs on one side of the body at the time. They can also experience electric shock sensations that occur with certain neck movements, especially bending the neck forward. It's also common to have a tremor or an unsteady gait, and they can also experience vision problems as well, whether that's partial or complete vision, complete loss of vision, prolonged double vision, or blurry vision. So the diagnosis of MS, there are no specific tests for MS. A diagnosis of MS often relies on ruling out other conditions that might produce similar signs and symptoms, which is called differential diagnosis. So some of these tests include a blood test, which helps rule out other diseases with symptoms similar to MS, a spinal tap lumbar puncture, which is taking a small sample of cerebral spinal fluid and which is removed from the spinal canal. And then this sample can show abnormalities in antibodies that are associated with MS. You can also get an MRI, which can reveal areas of MS on your brain and your spinal cord, and then evoked potential tests, which record the electrical signals produced by your nervous system in response to stimuli. And these tests, you can either watch a moving visual pattern, or there's short electrical impulses that are applied to the nerves in your legs or your arms. So the effect of MS on exercise response. MS can result in significant physical symptoms such as muscle weakness, abnormal walking mechanics, balance problems, fatigue, cognitive impairment. Patients with MS frequently decrease physical activity due to the fear of these symptoms worsening. So people who have MS and exercise are also very susceptible to fatigue, heat intolerance, and falling. So you definitely have to change your exercise program based on these factors. And some other problems such as spasticity, neurologic, or cognitive deficits may also influence the exercise program as well. Individuals can also experience numbness or tingling when starting to exercise, and this is actually due to a rise in the core body temperature resulting from exertion. And exercise that's too aggressive can bring on severe fatigue and injury, which we said we want to prevent, especially since individuals with MS are really susceptible to fatigue. And many report an increase in symptoms approximately 30 minutes after exercise. However, these changes in symptoms are not permanent, nor do they cause any damage. So management and meds. There is no cure for MS. treatment typically focuses on slowing the progression of the disease and managing MS symptoms. So there are two treatments for MS attacks, which is steroids and then plasma exchange. So the corticosteroids are just prescribed to reduce nerve inflammation, and then the plasma exchange is where plasma is removed and then separated from your blood cells. The blood cells are then mixed with a protein solution, albumin, and then put back into your body. However, the more popular way of treatment is just to seek physical therapy. A lot of people can also use muscle relaxants, do infusion treatments, take medications to reduce fatigue, and medications to increase walking speed as well. So this is the case study that I put together for an individual with MS. So Mrs. Heller is a 35-year-old sedentary female. She was diagnosed with MS 5 years ago. Her mother also has MS, who is still alive and well. She used to be a consistent smoker, but has stopped within the past 2 years. She has been physically inactive, and her symptoms seem to have worsened. She has problems with balance and gets fatigued easily, which has kept her from exercising. She is currently taking methylprednisolone, I can't really pronounce that, and that's to treat her nerve inflammation. Her goals are to improve her coordination and balance. Her BMI is 26 and her resting blood pressure is 130/80. Her total cholesterol is 174. Her LDL is 136 and her HDL is 38. So that's a case study. So for exercise testing, since these individuals get fatigued really easily, I didn't want to do anything crazy in regards to the exercise testing. So for aerobic fitness, I felt it was best just to do the 6-minute walk test, which is the distance an individual walks in 6 minutes. Pretty easy and basic for an individual with MS, depending on their symptoms. For muscular fitness, I did the hand grip dynamometer test, and that measures the maximum isometric strength of the forearm and hand muscles. For balance, the single leg stance for about 30 seconds, an individual just balances on one leg. And for flexibility, I did the sit and reach test, used to measure the hamstring and lower back flexibility. So in regards for her exercise prescription, I did it where aerobic and resistance training was actually on the lighter side, whereas balance and flexibility, she did a lot more throughout the week, because that was also two of her main goals that she wanted to improve upon. So for aerobic training, about 2 to 5 days a week for 35 minutes of continuous activity at moderate intensity. So that's going to be about 40 to 70% of her VO2 max. And she can either do like walking or swimming. It actually, when I was reading for the treatments that patients with MS do, it is said that it's actually really good to do aquatic activities just because it's really good for their joints, and they do have a harder time with balance and coordination as well. So for resistance training, I did 2 to 3 non-consecutive days per week, and that's going to be about 3 to 5 reps and 3 sets for about 4 to 10 exercises, and that's going to be about 40% of her VO2 max. And that consists of bicep curls, walking lunges, and squats. And she would normally start with lightweight, considering she doesn't exercise consistently. And for balance, she would do about 5 days a week for 25 minutes, and that will include heel to toe walk, pilates, balance on a physio ball, and yoga. For flexibility, that's about 7 days a week, and that'll be for about 10 to 15 minutes with daily stretching, and she just needs to stretch to the point of feeling tightness. And so for my conclusion, MS affects every patient differently. The signs and symptoms really vary depending on the type of MS that they have. However, we learned that physical activity can improve and manage these specific symptoms. Bottom line, it's just important to stay active when diagnosed with MS, and the exercise doesn't also have to be a rigorous cardiovascular workout to provide benefits. They can do things such as going on a walk or taking the dog on the walk, walking around the house, doing chores around the house, gardening, things like that. You don't have to do a crazy exercise routine every week. And like I said before, doing too much can strain the muscles, increase pain, and put too much stress on the body, so you never want to exercise to the point of fatigue. And these are my references.